Nose bleed. When blood is gushing out from your nose, it is called nose bleeding, and in medical terms, it is referred as epistaxis. There are several things that can actually make one bleed from the nose. Number one is dry air. Number two is injury, that is trauma to the nose. Either as a child, the child has inserted something in that nose that has traumatized the nose, or somebody punched your nose, that could make you bleed. Number three is cold. Number four is allergens. Number five, it could be a tumor there in the nose that is making you bleed. Number six is hypertension. When you are hypertensive, you are at the risk of bleeding from the nose. That is why it is good you control your high blood pressure. Most people that bleed from the nose, they do not even know that they are hypertensive. It's until they land in the hospital, they will tell them that the cause of their bleeding from the nose is as a result of high blood pressure. Number seven is recreational drugs. People who take recreational drugs like cocaine, heroines, they are the risk of bleeding from the nose. Number eight is pregnancy. One who is pregnant is at the risk of also bleeding from the nose. Also, some certain medications like blood thinning medications, e.g. warfarin and all the rest, can make one also to bleed from the nose. So here in this video, I'll be giving you steps what to do when you see somebody bleeding from the nose, the necessary things you have to do, okay, to make that bleeding to stop. And when the bleeding stops, what to do next. That is what I'll be telling you in this video. So when you see somebody bleeding from the nose, the first thing you have to do, tell the person to sit down. When the person sits, so while the person is sitting upright in a chair like this, ask the person to use this finger and this finger to pinch the nose. As he or she is pinching the nose, he should tilt forward a bit. He shouldn't go like this, no. He should come like this. As he is like this, he should hold this nose tight for 5 minutes. So while this person is pinching his or her nose, tell the person to breathe from the mouth. He or she should breathe from the mouth. So after 5 minutes, he should release his or her hands to see if the bleeding has stopped. If the bleeding has not stopped after 5 minutes, tell the person to still pinch the nose and still lean forward. Okay, so for 10 minutes. If at the end of 10 minutes the bleeding stops, so when the bleeding stops, this person should not do any strenuous work for some time, okay? And also anything that will require the person bending head for vigorous time, it should be avoided. The person should also prevent putting hands into the person's nose, like fingers, to scratch anything in the nose, all right? But if this bleeding recurs again, please visit the hospital, all right? That could be a sign of a serious health issue down there. If also as the nose, you're bleeding from the nose and the bleeding did not stop that day, please go to the hospital immediately. If you also notice dizziness, like, you understand, that is a sign of anemia, you should also go to the hospital, all right? You don't have to wait. If it is a child below 2 years, you do not have to wait. Even if the bleeding stops that day, take that child to the hospital for them to find out why that child bled from the nose, because most times children can actually put foreign objects in their nose without their parents knowing. Okay guys, these are steps to take when you see anybody bleeding from the nose. All right, bye.